Welcome to Nursing 213, and your first unit on your syllabus is the Family-Centered Care under Unit 1, Managing the Family and Functional Health Patterns and Health Management Patterns. So we will be looking at the family-centered care, and some of your outcomes are to analyze the nurse's role in the various settings where children will be provided care. Then the role of the pediatric nurse, you need to be able to describe how the pediatric nurse currently fulfills responsibilities for family advocacy, caring, disease prevention, health maintenance and promotion, health teaching, support, counseling, coordination, collaboration, ethical decision-making, research, and healthcare planning. These student learning outcomes are located in your outline for this course, so you will need to follow those. The third thing is to look at the family unit itself. You will need to review the descriptions of different types of families that you were introduced to in your maternal course. Identify stages of family life cycle, and to identify prevalent cultural norms according to CUSIN for child rearing. Throughout this course, we will have references to CUSIN and to evidence-based practice and to Healthy People 2020. All of these will provide guidelines for this course, and you will see them on exams as well as on NCLEX. So we will start with that particular section to examine, and you have your PowerPoint on family-centered care, and again at the front you see it listed: philosophy, role of the pediatric nurse. In additional references and readings for you in Chapter 1 of your text, you have looked at probably a portion of that for OB content, but we will be looking at it now in regards to the family with an infant or a child. So that can be another reference for you. On this slide, you see a reference to the American Nurses Association, which again helps to drive what we do or how we plan our curriculum in regarding pediatric nursing. So it's built upon this quotation: the diagnosis and treatment of human responses to actual or potential health problems for this particular population. So you can see how we're invested in evidence-based practice. Some of the features of pediatric nursing practice, we will look at the care of this child and family unit across a health illness continuum. So you will be making assessments to determine, how healthy or how ill the child might be. The child is not in isolation from the family, so we must include data from the patient and the family or their extended groups, those who have some control or management of that child has to be considered, and their welfare as well. We will be using scientific knowledge, or we will refer to that as evidence-based practice, for the diagnosis and treatment of conditions. And throughout this practice of pediatric nursing, it's very important to exhibit a caring relationship and to develop that trust with the primary caregiver and the child. So some of the concepts or components that we refer to for pediatric nursing include family-centered care. You should be able to describe what is family-centered care. When you're taking into consideration the whole family, and even perhaps if the mother is pregnant and you're taking care of her toddler, one has to be concerned about the whole unit and how healthy are they. A therapeutic relationship is needed, and I know that you discussed that in your behavioral health class, and your communication approaches will be important within this course for you to apply those. So family-centered care, again, just to remember that. Advocacy and caring. Children, infants, and even through adolescence, they may not be able to speak for themselves on a particular healthcare issue or even lack of healthcare delivery within a specific area. So you as a nurse should always be examining, what are the common healthcare trends in an area that you work? What are the current healthcare providers and organizations, and how can you advocate for, that child? Disease prevention and health promotion are also two major elements of pediatric nursing. We always want to prevent any untoward situations for a child, or say even communicable diseases, and then we always want to promote health. We want even that child who may have a chronic condition, we want them to be at their optimal health and well-being as is physically possible. You're all about teaching, it's all about the teaching. So on each one of these components, there easily could be a point of reference to teaching. And you will be examining some research for this course and looking at how will you conduct teaching age appropriately for the child and how to prepare teaching aids for parents that are correct in regards to educational levels. Then we're always available for support and counseling in helping that family unit. Then you need to be able to differentiate between coordination of care and collaboration of care. If you're coordinating doctor's appointments, physical therapy, speech therapy, for example, you're managing that either on the unit, so it's not interfering with nap time, for example, or if it's within the community. And to do that, you have to collaborate. You have to speak, you have to communicate, and you have to plan with all of these agencies that might be visible for this child's situation. Then we always have to be concerned about ethics and that we're not violating any of the child's rights or the family's rights, and that all information is confidential. So that, again, becomes of concern. Then research. We have to constantly be looking at what is the research on a particular disease, on particular methods of teaching, or how parents perceive situations so that then we know how to promote health better, noting their altered perceptions. For example, often parents view their children who may have a high BMI that registers them as either overweight or obese as to being in a normal weight situation. So we know that there are perceptual differences, and that's been researched and studied. So then when you plan to teach a family or a child, knowing that they may already feel that there's nothing wrong, their child is not overweight. So we have to know what those roadblocks are for us in trying to teach. And then we're constantly using decision-making or critical thinking skills as we examine situations and use best practices or how do we teach an individual when we know that there might be a learning disability there in that family. So critical thinking. And throughout your textbook, you'll find some examples of some critical thinking situations where the authors give you a situation and then you're asked to think about, how you would proceed and provide care. So where are we going to do all this, and what types of environments do we find pediatric care given? Well, first of all, you have to think, well, where are the kids? So there is a major shift now of looking at what's involved in the community. Having the child hospitalized can have negative effects on the family unit, financially, socioeconomically, and even psychologically for the child. So the first attempt is to keep the child in their community or in their home. So how do we provide care in those situations? Or how do we make sure that care is appropriate and safe, and that the family has the resources that they need to administer that care? The other big area that we look at are our schools. Children spend the large amount of their waking hours within the school setting. So looking at how we assess health problems, how we provide preventive care, screening, follow-up and referrals within our schools is now becoming a greater issue, and that nurse who is in that school needs to be very much aware of community resources. Clinics, freestanding clinics, clinics that are associated with a particular hospital, urgent care clinics. So any of those types of clinics, we may see children in their family units. As I mentioned, more situations are cared for in the home setting now than ever before. So making sure they know how to use an inhaler, a peak flow meter, how to administer their insulin, how to titrate medication. So all of those things are very important as to the pediatric nurse equipping the family in that situation. And then, of course, there's inpatient care. And with that, the perception of the child as to why they are hospitalized, and they're there usually for short periods of time for acute illnesses, and what is the role of the nurse in that setting? Outpatient care, clubs and organizations. A pediatric nurse might be assisting with a camp, for example, or providing information on even the role of the nurse, as far as a career choice. And then sport practices. More and more, healthcare individuals are being hired to be on premises during practices and games, and we can also see the pediatric nurse moving into this area. Now, some of the major healthcare problems that we're seeing globally, nationally, and locally is obesity, and then the comorbidities that occur with that, type 2 diabetes, hypertension, arthritic changes. So the list is just forever increasing as to the comorbidities associated with obesity in children. Injuries, a child not being as equipped with cause and effect information of, I can climb that tree, but now how do I get down? That Alabama 4-year-old, for example. So there probably always will be that category for us to look at. But then again, a lot of teaching can be done for parents in all the settings that we would see children on prevention of injury, safety in the home, car seat safety, those types of things. Then, as you looked at in behavioral health, the concerns of family violence and domestic violence. And with this course, you will also have a collaborate that you listen to on pediatric abusive head trauma and will receive a certificate for that, which is required in Kentucky that you have CEs on that. So we will provide those for you up front so that you have met that requirement. Then we're always looking at trends or changes in mortality and morbidity rates for children, and that's an important statistic for us to compare. You need to also be aware of the influence of culture and diet on the child. We know that nationally, Hispanic and African Americans and American Indians also have this increased alteration in their diet that enhances the probability of obesity. So those are changes that we might see in regards to culture. Again, looking at just prevention in the home, that before the mom leaves an OB unit, that we go over safety in the home, that when we see them in well clinics, that we review and touch base on that once again. And even in our PTAs or PTOs, that families that attend those who have younger infants, safety in regards for that next child needs to also be considered. Drowning is one of the leading causes of death in children, so teaching in regards to pool safety and prevention of that senseless death for sure. In all categories, in all age groups, injury is the major cause of death. Accidents are. So for each age group, that becomes, a very important topic to try to impact for that family unit. So the next few slides just show that comparison or change that we might see. And remember that we're going to approach this child on, when we talk about the different diseases, where they are on the wellness-illness continuum, and that's going to vary depending on the child's age, the severity of the physiological changes in regards to that condition. So no two children are exactly alike who have asthma, who have diabetes. Each of their conditions will be slightly different, and we need to remember that it's not just a cookie-cutter type of approach to our nursing care. Then when we look at the category of children who are chronically ill, who might be within a hospital setting more often, or they have a longevity of hospitalizations, say a child who's diagnosed with leukemia, for example. So regardless if it's a chronic condition or an acute occurring, we always need to focus on the child's developmental age versus their chronological age. So how are they able to communicate? A child with Down syndrome, for example. So how do I relate to this child differently? And I would need to know what is their level of functioning. We always want normalcy, meaning that we try to have the environment of the child and the child's activities and nutrition all to be as normal as possible, stimulation to be normal as possible. Now that has to be considered within the scope of what is the condition that the child has. We need to determine how the child is or is being cared for at home. Always that should be part of your history and information, is how are they coping at home. Tell me how you manage this at home. It's a good lead-in, open-end response question that you could use to obtain that information. We always want to promote the child's maximum level of growth and development. So even if they're sick, their growth and development, there is still a need for that to be accomplished. Now, if they're very sick or hospitalized, often they regress, and we need to often explain that to parents so that they have an appropriate insight as to their child's behavior. Then you're always assessing the family's response to the illness. So again, the example of the child who may have leukemia, how is the younger sibling taking in all this information and changing their environment, and what is their perception, and how is it affecting them? We always want to involve the family in the care if at all possible. If the parent is too emotional at a certain point, that might affect the child's ability to cope. So you would make a decision that that is within the scope of nursing practice as to how much that family would be involved. Same with the procedure. We always want to encourage self-care, not to add on to the condition, the sick child syndrome, where we're enabling the child to stay within that mode of, well, I'm sick and I can't do this. We want to maintain their routines as much as possible in the hospital setting or even at home. So often on a history you might ask, well, tell me what a typical day is like. Tell me what nap time is like. Are there any rituals that are done at bedtime, so that I know? Do we need to leave a night light on? What are their words for elimination, for example? So anytime we see that the child is sick, we could have a whole list of nursing diagnoses, and I've listed several here for you to consider. There can be altered growth and development. They can have a delay, a risk for altered family processes. Often we see the family at a point where they're in crisis or their coping skills are not sufficient to help them through, a particular disease process that the child is, having. Anxiety or fear. Risk for injury, based on a surgery, what scarring might be there. Diversional activity deficit, impaired social interaction, self-care deficit, and body image disturbance. And I'm sure there's more that you could even think of, but when you look at this one page, this gives you a template, really, for test question formation for NCLEX. You can almost see in every test question or ask yourself, when I'm trying to choose an appropriate response, has the child's development been considered? Is it a choice where the family is being taught or we're an advocate for them? Is it a choice that you're given to promote maximum level of growth and development? So you can see all of these being foundations for test items on NCLEX and also on our exams and your ATI. So this becomes a good measuring tool for you to use when, trying to select, the best answer. Another tool that will help you with test taking and also your plan of care is Maslow's hierarchy of basic needs. So I know that you know this theory, but this is just a reminder to you and some examples of what would be occurring or being accomplished in each one of those needs as we move up that hierarchy. So, for example, if you have a test item where one of your answers or options to select, you're providing for a physical need, based on the information that's given in the STEM. And then you have a love or belonging one, far as a psychosocial type of response. You would need to select the physiological need first. That's always a priority over even growth and development and love and belonging, or even pain management. So physiological is almost always your indicator of choice. So I hope this has given you some thoughts for transitioning into Nursing 213 in regards to pediatric nursing, the role and function. And in your Chapter 1 in your text, if you would look at several things that are listed there, for example, Table 1.1 gives you concepts of family-centered care. Now, to look at that and read through those, and again, those might be turned into a test question very easily. Health maintenance and promotion. The change or shift in care as we're seeing that. Cultural competencies. So again, look through that chapter. You'll see information given on infant morbidity and mortality rates. So you can see exactly how that has changed and the importance of those. And then legal scopes of practice. So it gives you more examples of the few, in addition to the few that I've listed here for you. So be sure and look at those readings. Make sure you can answer the student competencies, learning competencies for the unit. So this concludes the family-centered care in philosophy of nursing, PowerPoint, and Collaborate for you to respond to. And we'll use some activities in class that build upon this particular Collaborate.